Good afternoon and welcome to the first ever Clinical Research Nurse Day. We are so excited to have you here. My name is David Kissinger. I'm a registered nurse from the state of Ohio. I'm the Chief Vision Officer of Nurse Now Staffing, and we are very excited to have you participating here with us today in an overview of clinical research nursing with Elizabeth Ness. Elizabeth is a registered nurse. She earned her BSN from Boston College and her MS in nursing education from the University of Maryland School of Nursing. Her current position is the director of the Office of Education and Compliance at the Center of Cancer Research, part of the Intramural Research Program and the National Cancer Institute in Bethesda, Maryland. Her primary responsibilities include coordinating, developing, and evaluating both education and quality management activities for the CCR. Prior to working for the NCI, Ms. Ness worked for 6 years as a Phase 1 research nurse at Lombardi Cancer Center in Washington, D.C., and for 3 years with a research consulting firm in Bethesda, Maryland, where she worked on clinical trials for the NCI's cancer therapy and evaluation program. She is an author and a co-editor of the 3rd edition of the Oncology Nursing Society Manual for Clinical Trials Nursing, and was project team lead for the 2nd edition of the Clinical Trials Nurse Competencies. Ms. Ness is also active in the International Association of Clinical Research Nurses and currently is the co-chair of the 2020 conference. Ms. Ness has several publications related to clinical research and has presented nationally and internationally on topics related to clinical research and clinical trials. It is with great pleasure that we welcome Ms. Elizabeth Ness to clinical research nursing and the overview that she is about to provide of clinical research nursing for you today. Ms. Ness.
Great. Thank you, David, for the kind introduction and to be able to kick off this very first inaugural Clinical Research Nurses Day. I'm very excited to be able to be here and to do that. So what I'm going to cover is just really an overview of clinical research nursing. I think there's a very rich history, and I don't know if all of us in clinical research understand that. So sort of in the beginning, I like history. So a lot of what when I present, I pepper history, the historical perspective throughout, and certainly that's appropriate for this session today. But the founders of Rockefeller Hospital knew that a successful clinical research program was going to require the participation of well-educated nurses. And they did hire a Nancy P. Ellicott as the first superintendent of nurses at Rockefeller Institute Hospital. She was a graduate of Johns Hopkins Hospital School of Nursing, which at the time was the most rigorous nursing school in the country. And it was her leadership that set the high standards for the roles of nurses in this new field of clinical research. The Rockefeller Hospital served as an important training ground for research nurses, and many women who worked under Ellicott early in their careers carried this expertise in nursing to other research settings as other medical institutions began to incorporate research into their institutes around the country. She actually was a very fascinating woman. She did one of the things that she actually did a patent on was the linen hampers on wheels, which I think many of us nurses can appreciate. Very inventive at the time. So at the time, the training for nurses was really just beginning to formalize at Rockefeller. And Ellicott understood that it was an important role. And I think this is taken from Rockefeller University's website, but she wrote in one of her writings, that in order to make possible the realization of the aspirations of the founders of the hospital, the nursing must be of very highest type. Records must be most carefully and accurately kept, symptoms observed and recorded, reports intellectually and faithfully made. For a lapse in vigilance or in a specimen lost in a moment of heedlessness might render worthless the labor of many weeks. And I think that we certainly know, 110 years later, the importance of accurate source documentation and the vigilance that we need in our specimen collections and other procedures, I'll add, in our clinical research environment. So I do have a slight oncology perspective working for the National Cancer Institute. And I know that between 1910 and certainly 1960s, there were many nurses involved in clinical research. There actually was in Hopkins School of Nursing magazine in the 40s, one of the nurses wrote about being a psychiatric research nurse coordinator. But in the mainstream media, if you will, mainstream literature, it wasn't until the 60s that we started to see this new role of chemotherapy clinical trial nurses, if you will. Nurses needed to learn new skills related to chemotherapy. They had new knowledge related to the clinical research aspects, and they had a new collaborative role that they played with their physician colleagues. The literature, then throughout the 70s and then into the early 80s was very descriptive in nature, outlining the role of the research nurse, particularly in the cancer setting. But in 1984, I believe it was Mullen who began to introduce the specialty, if you will, into other nursing specialty practice or disease areas. The 90s saw more description in the literature about the oncology nurse role and the activities that they were involved with. But still, most of the literature provided anecdotal types of evidence. In 2000s, we started to see a little bit more critical and substantive literature surrounding the role of the research nurse. We saw some case studies approaches being utilized to demonstrate, what the role was in terms of being an educator, an advocate, and a protocol manager. Also then around 1990, the Oncology Nursing Society had established a clinical trials nurses special interest group. And these nurses were involved with study coordination activities and possibly also some direct care for the research participants. But out of the CTN-SIG, as we fondly refer to the group as, they actually had made a bit of an impression in the oncology nursing, clinical research nursing community. In 2000, they actually published the first edition of the Manual for Clinical Trial Nurses. It did contain some international sections as well. And it was designed to help the novice CTN learn about their role. They did come out with a second edition in 2008 and then a third edition in 2016. The special interest group also, through the work of Dr. Heidi Ehrenberger at the time, or doctoral candidate at the time, developed a valid and reliable tool to assess the role of the research nurse within oncology. It was referred to as the Clinical Trial Nurse Questionnaire. This questionnaire has been validated and used by others to help define the roles and responsibilities of nurses in clinical research, not only in the US, but in Italy, Australia, and most recently in Korea. So also around the same time, 2007 seemed to be an extremely good year for clinical research nursing practice in terms of beginning to define not only the specialty practice, but also competencies associated with clinical research nursing. The United Kingdom started some competency development. The National Institutes of Health Clinical Center, as well as the Oncology Nursing Society's Clinical Trial Nurse Special Interest Group. So in the UK, they took a couple of years. They had a landmark change in their policy in terms of the national health services in the United Kingdom. And research became sort of frontline core services that were led increasingly by nurses. They defined a clinical research nurse as any nurse who is employed to primarily undertake research in a clinical environment. They started their working group in 2007, and in 2008 published their first set of competencies with a second edition in 2011. And that is the last formal edition that they have. They have a little bit different structure now within the National Health Services. But to give you an example of what some of the CRN competencies were, you can see those here: to demonstrate understanding of the background, political influence, and strategy regarding clinical research in the UK, to work within and adhere to the requirements of research ethics, research governance, and legislation, to understand, apply, and promote the principles and practice of obtaining a valid informed consent, and to apply professional knowledge and skills to facilitate efficient, safe, and participant-focused clinical research. Also in 2007, the National Institutes of Health Clinical Center Nursing Department began a 4-year initiative to define and delineate the practice within the specialty of clinical research nursing. One of the first activities they pursued was to develop a taxonomy for the specialty of clinical research nursing practice. Using a Delphi approach, the researchers developed and validated the overall domain of practice for clinical research nursing to include care provided to research participants, as well as coordination of care and services and activities to support protocol implementation, data collection, human subjects protection, and participation in team science. They established 5 domains of practice, which I'll show you in a minute, and identified 52 activities within the specialty. The clinical research nursing practice domain was further conceptualized to define and name 2 distinct roles and responsibilities performed by nurses practicing in clinical research. And these 2 roles represent the 2 main nursing roles that are in a clinical research setting. And so you can see here the 5 domains of practice and ultimately the 2 roles that the clinical center nursing department defined within the specialty practice of clinical research nursing. The 2 roles include the clinical research nurse, whose primary focus is on the direct care of the research participant, and then the research nurse coordinator, whose primary focus is on study coordination. The group also went on then to develop competencies within those 5 domains of practice and set out to help with further role clarification and standardization. In 2007 also, the clinical trial nurse competency development project started really looking at the same similar types of activities that was going on in the NIH Clinical Center and in the UK. We knew in oncology there was a great variety of clinical trial nurse position titles, as well as how the role was implemented. We felt there was a need to validate the unique contribution that nurses do bring to clinical trials. Again, while the literature was, there was some descriptive literature, there wasn't a lot on defining the role. And ONS members, especially from the special interest group, really needed resources. So a work group was put together. There was a project team of 5 ONS members that currently were working within oncology clinical trials. They were chosen based upon their expertise in clinical trials. And their mission was to delineate core values, skills, knowledge, and expertise required to become proficient as an oncology clinical trials nurse, trying to also highlight those unique contributions that nurses do make. As with many of the, or all of the ONS competency development projects, they have a 3-step process. Initial competency are drafted based on the literature by the team. There is a field review, then there is an expert review. And the decision was made initially to focus on the novice CTN. When the competencies were set out for expert review, there were a total of 9 competency categories that you can see listed here, and a total of 54 competency statements associated within these 9 categories. Back in 2015, a project team was put together that had a couple of members from the original team as well as new members. And another literature review was conducted because there had been quite a bit of additional evidence in terms of supporting the role of the clinical trials nurse, as well as additional information in the literature related to competencies and dividing knowledge from behaviors, which we had not been seeing before in the competency world, as well as the need to have levels within competencies. So after that literature search was conducted, the same process was also utilized. Also, the team developed a conceptual model which had knowledge at the core of the clinical research or the clinical trials nurse, and also level 1 behaviors and level 2 behaviors. So level 1 behaviors being those that a novice nurse would be expected to achieve their competency in about 2 years of practice, and then level 2 competencies or behaviors for nurses in the role greater than 2 years. There were also some other encompassing documents to help support the practice, including communication, the ANA Code of Ethics, the ANA and ONS Scopes and Standards of Practice, and the Advocacy for Patients and Research Study Integrity. And then after the various reviews and revisions, there were again 9 categories, but this time we added categories such as data management and information technology, as well as then removing the communication because that became part of that model, if you will. And this just gives you a little bit of an idea of what the competency, one of the categories would look like. I don't know how well this will show up on your screen, but there is a section for required knowledge, a section on resources, and then level 1 and level 2 behaviors. So this competency, adherence to ethical standards, includes behaviors such as performs clinical trials duties in accordance with standards of nursing practice and code of ethics, adheres to federal and institutional requirements for research misconduct. And level 2 behaviors, a little bit more advanced in terms of working with the PI and others in the research program to develop and reinforce a culture which facilitates compliance with reporting research misconduct. Just to give you a little example of that, the 2016 competencies are available on the ONS website, but the easiest way, if you're interested, is to just Google CTN competencies 2016, and it'll come up. In 1960, the NIH began to fund in academic medical centers general clinical research centers. And those research centers or research units were managed by nurses and staffed by nurses to help conduct research. And in 1989, the nurse managers got together and established the National Association of General Clinical Research Center Nurse Managers. It allowed them to meet a couple times a year, exchange knowledge and ideas, establish nursing standards in these research centers, consult and support and advance competencies for the nurse managers, and also to help set standards for clinical research, education, training, and common research procedures. The group expanded their membership to include clinical research nurses that worked and managers that worked outside of the NIH funded GCRCs, and also incorporated international colleagues, and particularly from the United Kingdom. In 2006, when the NIH funding mechanism changed for the GCRC program and was replaced by the Clinical Translational Science Award program, the new CTSA managers and the clinical center nursing leaders established a National Clinical Research Nursing Consortium to help advance the specialty of clinical research nursing. So you'll notice in around 2006, 2007, sort of that magic year of 2007, a lot of activities were ongoing to begin to really look at the specialty practice of clinical research nursing. And it is out of this group that in 2009, 7 of these nurse managers organized and founded the International Association of Clinical Research Nurses. And their first meeting was held in Boston that same year. Early in the process of developing the scopes and standards of practice, the IACRN Board of Directors made a decision to pursue obtaining American Nurses Association recognition of clinical research nursing as a specialty practice. A lot of hard work went into developing the clinical research nursing scope and standards of practice, but they were published initially in 2016. And with the ANA's revision of their general nursing scopes and standards of practice, the scopes and standards of practice team is revising the current standards to be in compliant with the general ANA standards as well. So they are currently being revised. But as with the ANA and other specialty practices, general and specialty, the scopes of practice identifies sort of the who, what, when, where, why, and how of clinical research practice. It identifies, who are clinical research nurses, defines those, identifies where they do practice, and then breaks into the standards of practice, which describes the art and the science of nursing and details the associated competencies with each of the standards. Clinical research nursing has been defined then as a specialized practice of professional nursing focused on maintaining an equilibrium between care of the research participant and fidelity to the research protocol. The specialty practice incorporates human subjects protection, care coordination and continuity, contribution to clinical science, clinical practice, and study management throughout a variety of professional roles, practice settings, and clinical specialties. So you can begin to see here in this definition some of the work that back in 2007 that began to lay the foundation for defining clinical research nursing as a specialty. You can see here in the scope of clinical research nursing, the various roles. There's clinician roles, that of the direct care provider, the study coordinator, or an advanced clinician, our nurse practitioners. There's the manager, the educator, the advocate, a regulatory specialist, and a nurse scientist. The basic principles that guide clinical research practice are safety and self-determination, research-informed consent, fidelity to the research protocol, and regulatory compliance. There are 17 standards that are divided into 2 sections. For those of you who may be familiar with other ANA standards, these numbers should not be surprising to you. And each of the standards has associated competencies for the clinical research registered nurse, as well as for graduate level prepared clinical research nursing and the advanced practice nurse as applicable. So here are the standards of practice categories. Again, they're the same as what is in the ANA general standards and the standards for professional performance. And some of these, as I have alluded to already, are going to have been changed within the ANA standards, and the clinical research nursing scopes and standards is currently undergoing revision. But just to give you an example of the current version, you can see here in the assessment standard some of the competencies that the clinical research registered nurse documents relevant data in a retrievable format, ensuring IRB requirements for research data, and recognizes the research participants as the authority on their own health by honoring their care preferences, including their right to participate or withdraw from a research protocol. And an example here of a professional performance standard in terms of ethics, the clinical research registered nurse advocates for the research participants' rights to informed decision-making and self-determination, contributes to the establishment and maintenance of an ethical environment that is conducive to safe, quality healthcare that maintains fidelity to the research protocol. And just one other example of a competency in this category is the clinical research registered nurse endorses the understanding that the primary commandment is to the research participant regardless to setting or situation, with a focus on the core principles and guidelines for research involving human subjects. I did want to just share a little bit more about IACRN. There are a list of committees as well as various chapters, full chapters, as well as pilot chapters. And as the I in the organization's title implies, it is international, with chapters in China already and the United Kingdom, Ireland, and also looking at pilot chapters in Africa and Shanghai. The IACRN in October 31st of last year released the core curriculum for clinical research nursing. You can see the examples of the chapters that are listed here: the evolution of clinical research nursing, protection of human subjects, recruitment and retention, study conduct and participant care, as well as professional development for the clinical research nurse. This is currently available as an ebook via Amazon. And I had the privilege of serving with Dr. Margaret McCabe as a co-editor on the core curriculum. Also, a little bit over a year ago, beginning of 2021, the Clinical Research Nurse Certification Council was organized. And if you want more information, you can visit the website here, crncc.org. And basically, this is a organization that is certifying nurses in clinical research nursing. The certification will be CRN-BC. Those will be the credentials. And this is the only certification that recognizes expertise as a clinical research nurse. The certification is earned via a professional portfolio process to validate the individual's expert performance in clinical research nursing. The next several slides I'm going to show you are taken actually from the certification handbook. And so again, for more information, if you are interested in becoming certified as a clinical research nurse, I would advise you to look at the handbook. But there is a process. There is a certification application form. As with other certifications, there's a minimum number of hours as a professional in the practice that you have to maintain, as well as a minimum number of contact hours for continuing education that is in clinical research. Also, there are additional professional activities that are required. There is an exemplar describing the performance and development as an expert CRN in 4 key categories: professional growth, professional practice, team focus and interprofessional collaboration, and quality and safety. The exemplar is for the initial application only. There is a resume, there's a template to follow for that, and the application process is online. As I mentioned, there is a minimum number of years required in the clinical research nursing arena before you can apply, as well as in as a nurse, and you need to have an unencumbered license or what would be the equivalent in another country. The continuing education credits focus on 3 years prior to the application submission. There's a point system that is allotted, and so there is a minimum and a maximum number of continuing professional development credit that is required. Professional activities is a little bit longer period of time, over a 5-year period of time, with again a minimum and maximum number of points that can be earned. Some of the professional activities categories include clinical research presentations, scholarly editing and writing, research and scholarly projects, professional activities, as well as academic education. And the exemplars, I mentioned already, you can see the categories there. There's one exemplar, the sort of 4 subtopics that need to be addressed with, again, a minimum number of points that are required, and with a total of 64 points possible, so 45 points out of 65. There is a rubric for scoring that is available in the handbook as well, that is utilized, obviously, by the portfolio reviewers. There is a recertification. There is a 5-year renewal cycle. There's 2 options, with CEs focusing on clinical research and some general nursing, or an option for CEs combined with professional development or professional activity points. So if you are interested in learning more about becoming a certified clinical research nurse, go to the CRN-BC's website, take a look at the handbook. You can see here there are 2 applications a year, April 1st and October 1st. So the application window opens the month before. You can see the current fees listed here. And so I think in summary, I think there is a very rich history of clinical research nurses in a variety of settings, as well as in a variety of roles. We have a professional organization that we have a core curriculum, and we now have certification. So I think that we truly have become a specialty practice as clinical research professionals, especially with the certification that was started last year, April 1st, with that review cycle. So I hopefully those of you who may have been involved in clinical research for a while, that you learned something new. Those of you who may want to venture down the path of becoming a clinical research nurse, hopefully you have a nice understanding of really the rich history. This is not something that just happened to, start. It has been going on, recognized as clinical research nursing for over 100 years. So I will stop there, and if anybody has any questions or comments or anything to add, I think we do have some time for that, right, David?
We certainly do, Liz. If anyone would like to ask any questions, we have plenty of time for questions or comments. Just unmute yourself, and if you're able to remove your or turn on your video, that's always helpful as well, so we can both see and hear you.
I just wanted to tell Liz that was a very good presentation, and I think it makes me very proud because of how far the clinical research nurse position and the career has come in the years that Liz and I have been doing it, which is a long time.
Long time. Well, thank
That's
you,
great.
Kelly. I really appreciate that. And it's really nice to see you, I must add.
Nice to see you too.
Lauren.
Awesome. Am I able to jump in? Liz, that was phenomenal. So much good information. I always think it's really important to know where we have come from to figure out where we are going. And I think probably everyone here can agree that clinical trials we're moving into a space where we have literally never been before. So many things going on with decentralized trials. These roles are changing. Where do nurses fit in? I mean, I know some want to stay bedside. I know Fast Track, we talk to a lot of people who are saying, I'm so burnt out of bedside. I want to be remote, or I just don't want to be patient facing anymore. What's the future? Where are we going?
Yeah. Well, I personally think that's the beauty of nursing. We can kind of do whatever we want to do. We can create a niche for ourselves somewhere. I think David is a good example of that. Kelly also with her business. I once heard a presentation by a nurse that said, if you are not at the table, you are on the menu. And I think that nursing has to be at the table. I think nurses need to be at the table when we're talking about developing protocols, writing protocols. I think nursing needs to be at the table when we talk about recruitment, retention, when we talk about a clinical trial management system, when we talk about billing and finances. I think that we still have, in my opinion, a ways to go. I think nursing has a voice. I think nurses are getting stronger voices, but I think nursing in general tends to be quieter and doesn't always speak up. And I just think I don't know if it's just innate. I don't know, I know certainly it's not something we're taught in our entry level to practice arena. But I just, I keep thinking about all of the areas that we now want to include patients, right, into developing protocols, the whole PCORI, all of that. Where's nursing? Nursing should be there too. We are the most trusted profession. So it makes sense to be there. So I think that COVID has helped to highlight the importance of clinical research nurses and nursing, within that research arena in general. But I do think that I still think we have a bit of work to do, but I do think that nursing can go anywhere. I think clinical research nurses can go really anywhere. I mean, you can create a niche, you can create a job for yourself. The clinical research enterprise is so vast, and I think that I've been doing this for a long time, several decades now, and I still know that there's so much more I need to know. No one person can know everything in the clinical research enterprise. And I think it's that communication and that willingness to, go out on the limb. If you're done with bedside, done with chair side, done with direct patient care, there's always what I call the non-clinical side of clinical research. And that is huge as well. So there are a lot, of things, a lot of settings for clinical research nurses, I think, to practice. It's a different looking practice than with a patient. That's all.
That was
sorry,
awesome.
long answer to.
No, I appreciate it. And what I appreciate is I think embedded in your answer, you gave people a lot of good tips on how to advocate for themselves. I think a lot of times, particularly with nurses, you're so used to advocating for your patients, advocating for them to get the best of everything that they deserve. And I don't know what that is about. A lot of nursing personalities tend to put yourself last and not necessarily advocate for yourself. So I think, Liz, what you said, there's a lot of power embedded in that, where you have to initially really advocate for yourself for that place at the table. So I appreciate that answer. That was beautiful.
Yeah, thanks.
Ariel Davis posted in the comments. She said she wanted to let us know it was such an encouraging presentation and she loved it. And thank you for putting that together and sharing.
I just think that we just think of ourselves as worker bees, and I think that we need to give ourselves credit, much more credit than maybe we do give ourselves. I've worked with my first research job. I never thought about becoming published, but my investigator always put the research nurse coordinator as a second or third author on every publication because of the amount of work that we did. And I, go to another research setting and that's totally unheard of. And I'm not talking about larger group. I'm talking about like a single institution, you know, single site research study. And so I think that learning to advocate for yourself and, you know, why shouldn't you you coordinated all that data, you coordinated all the implementation of all those procedures, etc. You know, why shouldn't we be considered authors and be able to contribute to a publication, even if it's just reviewing for accuracy of the data that's being presented? So I think there's a lot of different ways that we can kind of brush off if you feel like you're in a rut, you know, kind of brush yourself off even in the same job and, you know, put a little different lens on it.
All right. Well, thank you so much, Liz, for your presentation. This has been very insightful and very educational and such a great representation of what it means to be a clinical research nurse in the work that you do. So thank you for that. We'll give everyone a few moments. Many of you are presenters on our next presentation on our panel discussion. So we'll give you a few minutes in advance of that. We are just in advance. We have just 13 minutes until that starts. So we'll go ahead and provide everyone a few moments to take care of anything they need to take care of in advance of our next part of our presentation, which will begin very shortly. Thank you all for joining, and thank you for being a part of the first ever Clinical Research Nurse Day.